Hi, it's Anna Runkle here, and you may know me as the Crappy Childhood Fairy. I've been lucky to recover almost entirely from my childhood PTSD, and it's taken a long time, and from time to time I still get wonky with my symptoms. It doesn't happen that often anymore, but one place where I almost always get triggered with my trauma symptoms is when I visit the doctor. I could never even put this into words before, but now that I'm mostly healed from my childhood PTSD symptoms, I want to express what I wish my doctors, all the doctors of my life, had understood about the effects of childhood trauma and about me. If you're new to my story, I use the term childhood PTSD as a colloquial, more specific way of talking about complex PTSD, or CPTSD, which is the kind that comes from chronic exposure to extreme stress and trauma. So I like the term childhood PTSD because virtually everyone knows what I'm talking about. It's the way that you're affected long-term, the way you still get triggered as an adult by what happened to you when you were a kid. Now, to be fair, there's a reason they didn't get it. The true scope of the adult effects of early abuse and neglect were really poorly understood by everyone until recently. So no one could know what it was exactly or how to treat it, really. But this is a fact. Every time I received health care, my trauma played a role. Either it was making me sick, or it kept me from healing, or it made it impossible to care for myself. The classic signs of CPTSD were all there. Headaches and stomach problems as a kid, more serious things as I got older. They probably thought I was a complainer. They didn't know, and the providers I saw, they were so busy, and I was so prickly, so I can hardly blame them, most of them, for not really listening to me. Or maybe I was too dysregulated with PTSD to know how to explain myself. But I can explain myself now. So I want to say, with the strength in me that comes from healing, what I couldn't say when I was struggling. To the pediatrician I saw when I was 8, when my mother's friend's parents made her take me in, and I was dirty and dehydrated and so sick with strep I couldn't even sit up. Thank you for the antibiotics. You saved my life. But I wish that you had asked more questions about what was going on at home. How is it that the grown-ups left me with a fever for 2 weeks without seeing a doctor or getting a change of clothes? And when my little sister came into the room with us, did you notice her dirty fingernails? They were nearly 1 centimeter long. She was only 3. Those infections on her skin were from dirty nails where she scratched herself. And I know how hard it can be to connect what you're seeing in children with a mother who's so smart and pretty and friendly and funny, but you're the only outsider who's going to see this, and we're counting on you. I know you saw that she was drunk or high. It would have been hard to miss it, and maybe that's why you asked if everything was okay at home. Thank you for asking that. Thank you for trying. But don't you know, I had to say that everything was fine. She was standing right there. And I wanted you to think that everything was fine. I was lying because I was afraid I'd get taken away from her. I wish there were more ways to help families without taking the kids away. And I wish you'd pressed a little harder or followed up or at least let me know that you knew that I could talk to you. And then there was the family planning clinic when I was in 8th grade. I know you wanted me to feel safe and respected and feel that I could trust you and think of you as my cool friend. You treated me how you would want to be treated. But you were an adult and I was just barely 14. Something was really wrong with the picture, and I'm sure you wanted to do whatever was necessary to help me avoid pregnancy, and I thank you for that. But I needed you to help me. No one ever asked me what was going on, if I was really okay or safe. Well, I wasn't okay, and I honestly expected when I came to the clinic that people would ask some questions about that. I was really nervous about it because I thought you might try to intervene. But no one intervened, no one asked. No one said, hey, you don't have to do this, or hey, you're too young, and that guy is trouble, and he doesn't care about you at all. But there was no one to check in with me on that. I couldn't talk to my mom. I was hoping that you'd open the conversation with me. I've always tried to look normal at the doctor. It's just a habit. I look up to you doctors. As a young adult, I was afraid all the time that people were thinking I was trash, and so I'd dress up a little bit to go to the doctor. And as a young adult, I always felt the need to hide what was going on in my life, the chaos, the relationship problems. So I want to tell doctors now, don't assume just because I have clean clothes on that everything's fine. Don't assume that just because I look middle class that everything's fine. And please don't assume that because I'm white that everything's fine. Just like none of us should assume things bad or good about people's lives because of their race or socioeconomic status, every person you meet is different. We each have our own story, our own problems, and our own strengths. Now, a lot of us who had a rough childhood were good at hiding what's really going on. Some people try to act tough. Some people try to act cheerful, which is sometimes just a way of acting tough. But just remember that we're trying to blend in. I always tried to look competent and agreeable and would have pulled it off almost all the time, except that the agreeable part was really hard to maintain. I've done it. I've seen others do it where we're so nice and then bam, there's this big occasional burst of pure, mean unreasonableness. I'm sure you've been on the receiving end before, but just so you know, we're not doing it to give you a hard time. It's a brain thing. Now, when crazy stuff was going on at home, I was so afraid that I looked crazy, or that I looked poor, or that I looked stupid. And I was afraid if you saw me like this, you wouldn't help me or listen to me. So I tried to seem important. And I know it just came off as angry or arrogant, but honestly, our discussion had just brought up a lot of pain, and my brain and emotions were dysregulated. I couldn't pull it back once it started. So can you see why I was trying to put on a nice face? I was embarrassed about being broken like that. And even today, when I'm too distressed inside to hear a word you say or remember how to take a medication, please don't assume that I don't care or label me as non-compliant. And maybe this is my pride speaking, but please don't assume I'm ignorant. My brain just does this when I feel stress. I get dysregulated. I get numb and I can't think straight, and I get clumsy and I overreact to things. So can I tell you what to do when that happens? Just hang out with me for a minute. Be present. Give me a minute, even though I know you don't ever have a minute. Let me know that you see me and you hear me and you believe me about the little things I tell you. And then maybe, if that goes well, I might feel like I can tell you the big things. A couple of years ago, when I was starting to develop a presence online with my Crappy Childhood Fairy blog, I got this idea how great it would be if I could have a primary care doctor who knew the effects of early trauma on health, and then I'd finally have a provider who understood the way my stuff can generate health problems and the way my healing can do amazing things to improve my health. I keep having health miracles. Now, I'm not a doctor or therapist, but in the last few years, writing and making videos for people with childhood PTSD and serving them, I'm more convinced than I was when I started that it's really possible to change our lives in powerful ways using what we now know about the adult effects of abuse and neglect in childhood. I don't think healthcare as a whole is keeping up with this knowledge very well. So it's really important that those of us who have experienced childhood trauma and suffered with it and found a way to heal, despite a huge lack of professional help that actually helped, it's really important that we have a place at the table. We need to be there too, informing the direction that this new awareness now takes us. In case you've never heard about it, I want to make sure every clinician and social service professional knows about the findings from the ACE survey. The survey developed for this study has become kind of a standard measurement of what are now called adverse childhood experiences, and they've helped identify how these experiences correlate with our physical and mental health throughout our lives. Do you know about this study? It was created back in the 90s by a couple of doctors, one from the U.S. Centers for Disease Control, one from Kaiser Permanente. So the ACE study was based on a survey with 10 questions about what you experienced as a child, along the lines of abuse, neglect, exposure to violence and addiction, that kind of thing. Those are the adverse childhood experiences. Get it? ACEs. And your ACE score is how many of those 10 actually happened to you while you were a kid. And I'll put a link to the survey below so you can take it if you want. And you will notice right away that the survey doesn't cover all the things that could have been adverse childhood experiences, but it's a standard measurement. And so the original researchers, whose names are Robert Anda and Vincent Felitti, discovered that the higher your ACE score, the higher the probability that you'll have a whole slew of health problems that we always kind of knew were connected to a rough childhood. Things like depression, anxiety, smoking, substance abuse, involvement in relationships where there's violence and that kind of thing. But they also found out about a whole universe of problems that we didn't used to know were connected to childhood trauma. Obesity, diabetes, ADHD, memory problems, heart disease, lung disease, reproductive disorders, cancer, skin problems, gum problems, chronic pain, problems with the nervous system and tissue and healing and blood flow and hormones. And in what way doesn't childhood PTSD get in there and increase our risk of everything bad? So without a doubt, every health problem I've ever had is very, very acey. Stuff like autoimmune diseases, migraines, asthma, chronic pain, and a stretch of years in my life where I had more than a dozen major surgeries, following which, for reasons no one knew, I just could not heal. Each surgery left me even more damaged, and it was a mystery. And it was not fun. It was totally terrifying. And I think it was after the surgery number 12 or 13 that I happened to find out about ACEs and complex PTSD. And I was working with someone who worked on ACEs, and then I read a book, and then I met a practitioner who worked with homeless veterans. And one night, when I was by myself, I kind of figured out the piece of the puzzle that had always been missing, the part that connected childhood trauma with certain quirks of mine that I thought were personal failings, and I realized I had likely been suffering all my life with brain and nervous system dysregulation. And I also realized that I had known for years how to re-regulate my brain. There was a writing and meditation technique that a friend had shown me that had pulled me out of a really bad depression once. So I doubled down on the writing and meditation techniques, and I started doing them twice a day, and I kept going, and that is when my real healing began. If you're part of the Crappy Childhood Fairy community, you know I offer a free online course on how to do this. I call it the Daily Practice. The links to it are below, and I run free phone calls regularly where you can come in and write and meditate with me and I answer questions, and thousands of people are doing this practice now. But the point here is, after flailing around with childhood PTSD for years, I figured out how to heal, and my whole life got better. I got happy, and I got healthy, and my relationships changed, and I remarried, and I started a company, and this was such a miracle. My medical nightmare transformed. My never-ending surgical problem did end. 2 years after the 14th surgery, I saw my doctor, and she said, it healed. And I had a surgery to get rid of the devices and workarounds that I thought were going to be a permanent fixture in my body. I'd tell you more, but it's too gross. So maybe another time. But I got it into my mind that maybe I'm not alone. Maybe a lot of people are having health problems related to trauma, and maybe they could have dramatic healing too. And maybe we could learn from each other. And maybe there'd be doctors and researchers who would totally want to be in on this and figure out why people with trauma are at such increased risk of somaticizing. That's when the trauma is expressed physically. And we could better learn how to flip the switch into unsomaticizing, into neutralizing that toxic influence of trauma and reversing the damage to our bodies. If it happened to me, it could happen to you. So we'd need doctors on board with this, right? And I started thinking, wouldn't it be amazing if I had a doctor who gets it? Now, I had a doctor at the time who I liked well enough, and I was at a visit, and I mentioned to her that I do this website and a YouTube channel called Crappy Childhood Fairy, and I asked if she could point me to the researchers and physicians who are at the cutting edge of this science, because maybe I could be part of finding a better way to help us, or at least I could get healthcare tailored to those weird AC problems that I tend to get. So with all this enthusiasm and spirit of curiosity, I asked her, who should I talk to? Was there a group or a study for high ACE score people like me? And I'm sorry to tell you, she had no idea what I was talking about. And this was only a few years ago, and I was not in a small town. I was at the flagship medical center of the health plan where the ACE survey was invented. My doctor said she'd look into it for me, but after a few weeks I hadn't heard back from her, and so I emailed her to remind her. And here's what she said. Hi, Anna. I don't have any formal additional training in ACE care, but feel comfortable and confident in my knowledge base of how these ACEs can affect adult health. I do not know of any directory of folks within the department with specific interest in this, but can think of a couple who do work with domestic violence prevention, and that might be the most relevant. I don't know why she thought that. There are, of course, other resources in our system we can avail of ourselves of within psychiatry, etc., if need be. Now, just in case that sounds like an okay response to you, it wasn't to me. It was devastating. I had shared this incredible miracle with her, that I figured it out, that I healed brain and physical problems that supposedly couldn't be healed, and I wanted to learn more, and apparently all she heard was domestic violence and psychiatric service referral. I can't tell you how ashamed I felt that I had ever said anything at all. But I'm the crappy childhood fairy, and I'm all about getting free of pointless shame and becoming my real, true, original self, which is a smart, kind, funny, sometimes cranky, but honorable person. And I'm a warrior when it comes to setting what's wrong with this world right. So, shame is not my thing. Okay, I told you a few of the things I wanted to tell providers, but let me give you the full list summarized. First, don't assume that childhood trauma, or ACEs, means the only opportunities to help people are while they're children. Healing is possible for people of all ages. Second, don't assume that because I look poor or that I don't look poor, that this means anything about trauma in my life. Trauma crosses all socioeconomic and racial lines, and so does resilience. 3, don't assume that when I'm inarticulate, this means that I have nothing to say. And don't assume that when I look blank, that I don't care. I might just be dysregulated. 4, don't assume that when I'm kind of emotionally reactive, that I don't know what I'm talking about. Doctor visits are just triggering for a lot of us. We're getting touched, we're getting asked questions, and we're getting some kindness and attention, and sometimes that feels weird for us. You never deserve rude treatment, but if you can, please try to be patient with us. Try to make space for an open conversation. If we open up to you, don't assume that you necessarily have to fix the problem or give us advice at all. You can say, I see, that sounds really hard. What are you going to do? Number 5 is, if you would, please don't ask personal questions that have nothing to do with the care I'm getting. Like, when I come in with an injured thumb, do you really need to know how many pregnancies versus live births I've had? Number 6 is, if my life has hard stuff in it, don't assume that the problem is that I just haven't been given the right patient education. I may know the facts perfectly well, but I'm struggling to act in my own best interest because I'm dysregulated. Number 7, whatever you do, please don't tell me that it's all just stress and expect me to have some big aha moment and be saved by this information. Stress-related illness is real illness, and while de-stressing would, in theory, help, it's still a real illness. Number 10, okay, don't assume if I'm uninsured, and I once was, that you need to tell me what to eat or why I should exercise or what analgesic means. And not to be picky, but you shouldn't assume that I do know what analgesic means either. It's nice when you respect my intelligence, even while you check my understanding. 11, I realize that some of my self-diagnosis may be wrong, but that doesn't mean you shouldn't listen to me. I would ask that you respect that I've needed to be my own researcher, my own advocate, my own caregiver for most of my life. And lastly, number 12, that's it. Just thank you. Thank you for being a doctor, nurse, medical assistant, nurse practitioner, physician's assistant, social worker, therapist, psychiatrist, counselor, researcher, analyst, professor, caregiver, or generous human being. I say all this because I wanted to express what was in here all those years, that I was trapped in my childhood PTSD. The frustration was in there, but also the gratitude, what it meant to me that you cared and that you were a solid, caring person with knowledge who helped. And even when you couldn't help, you tried to help, and you cared and treated me like someone who deserved to be helped and listened to. A few of you in particular really did that for me, and I'm thinking of a team of nurses who got me through a very hard night in the hospital one time. And my surgeon, Dr. Varma at UCSF, who was like Brienne of Tarth when I was getting through that major surgery ordeal I mentioned, and my doctor now, Dr. Marshall. Even though she admitted to me that her formal training was limited around the effects of trauma, she's curious and she learns about it and she listens to me and she believes me and she understands. The effects of trauma used to be a mystery, but now you know. And it's going to take a lot more study and more awareness, and even though you're so busy, more of that healing superpower that you guys are so good at. And we're counting on you.